Okay, I'm going to try this again. Every time I've tried to record, suddenly my phone goes off or something else, or like there's some people working, hammering at a building next door. Anyway, so today talking about minoxidil. We get asked about this quite often by our patients who are concerned about hair loss, which, I have a whole other video about, what to look for in hair loss and things like that, which I will also put out a disclaimer. I am not a hair specialist. I am not a dermatologist of any sort. It's just kind of, this is basic knowledge off the top of my head that I throw out there for folks. So if you are having some really extreme hair loss, I would recommend getting looked at in person by someone, of course, who specializes in this stuff, rather than just taking some general info here. But anyway, so while there are other medications and there are topical forms of minoxidil, today we're going to be talking about oral minoxidil that you take by mouth, just in a pill form. So minoxidil itself was actually created to be a blood pressure managing medication, so this is going to come into play whenever we talk about the side effects. And when using it for blood pressure management, you're generally going to be using doses of about 10 milligrams or higher per day. And for hair purposes, we're going to be using much, much lower doses. I mean, some people are on something as low as like 0.6 milligrams, generally speaking, we are going with either like 1.25 milligrams a day or 2.5 milligrams a day, something like that. But it can go up to about like 5 milligrams a day, depending on the person, of course, because everybody's different. So let's talk a little bit first about how hairs grow on the scalp, and that will play into how minoxidil hopefully works for people. So there are three main phases to hair growth on the scalp, and they're anagen, catagen, telogen, and that would be for growth, transition, rest. The growth period lasts for up to several years, and of course, growth, you know what it's doing, it's growing. When it starts transitioning, it's kind of quote unquote letting go, moving, more where the bottom, the root, so to speak, is moving towards the top, closer to the scalp. And underneath that is going to be where, a new hair after this one will begin to form and sort of push up and out. So that in the last phase, the telogen phase, which is the quote rest phase, it has kind of a bulb-like bottom part to that hair that has it anchored in place in the scalp. But eventually that is going to be let go and that hair falls out, especially, when the new hairs come behind it and push it on out. So how does minoxidil come into the picture? So it's not like, let me also say, it's not FDA approved for hair loss. For what that means to some people, that doesn't mean a whole lot. But anyway, and it's not 100% certain exactly how minoxidil helps. There are a lot of studies out there that, show evidence that it does help a decent amount of people, though certainly not everyone with their hair concerns. But when it comes to how it fits into working with your body, they think that it helps prolong the anagen phase, which is the growth phase of the hair cycle. And also it increases blood flow, which is, going to feed the hair. But they think that it prolongs the anagen growth cycle of the hair, which means that it would stay in place for longer and give other hairs more time to also develop and be there and be present. And also then I suppose it would take longer for it to push other hairs out and off of the scalp that had already grown. So this is not something to where it necessarily is like causing regrowth, like if you were completely balding. This prolongation of the growth phase isn't regrowing hairs in places where there are no longer hairs growing. So I don't really know how they are claiming that, other than maybe they could say that The increased blood flow helps with the follicles that are not doing too well. Anyway, like I said, not a hair expert, whatever. Anyway, so knowing this, that anagen, catagen, telogen, the three phases, growth, transition, rest, and the purpose supposedly that minoxidil is serving is that it prolongs the growth phase so that you hold on to those hairs a little bit longer and give the rest of the hair on your scalp some time to catch up. And then, of course, you would have an appearance of thicker hair on top of the head. So, of course, there's lots of other little things going on in there, but that's the meat of it. So what could we potentially see as issues with this? So the most common side effects, if you experience side effects, would be things like headache, low blood pressure, because remember, it was created to be a blood pressure medication, and so it could affect your blood pressure, although, like I said, this is in much lower doses than what we normally would prescribe if we were prescribing minoxidil to manage blood pressure. So take that, as you will. But headache, low blood pressure, difficulty sleeping, swelling of the extremities, like it could cause like a little bit of, ankle or foot swelling, something like that. Is because of how it actually acts in the body to lower the blood pressure. But anyway, the one that people may be most concerned about, at least our transfeminine individuals, maybe not the transmasculine folks, is that some people do note that whenever they are on it, that it causes increased facial hair growth. Not necessarily causing like terminal hairs, which are the thick black hairs, but certainly growth of those fine vellus hairs, which can eventually turn into terminal hairs though. So something to be aware of. If you're taking this for scalp hair growth, it can also affect some other areas of hair growth. So do be aware of that. Folks who should not be taking minoxidil are going to be those with some serious liver problems, anybody who's got like pheochromocytoma, pulmonary hypertension, and then heart disease. It kind of depends on to what degree and what exactly is going on, especially in terms of like heart disease, because there's so many different kinds of heart disease and conditions and whatnot. But of course, this is something you need to discuss with your healthcare provider. And then sometimes people will ask us, can minoxidil be combined with other types of scalp hair preserving therapy? Yes, it can. I personally don't prescribe more than one thing at once, because then if you have a side effect, how do you know which medication is causing the side effect exactly? And then so you don't know which one to either reduce or stop. So usually what I'll do is start one medication and go for several weeks to months or so before starting another one together. That's just my own personal thing. Not everyone operates that way. But just know that, there are other medications out there such as like finasteride that I have another video addressing that and how it helps block DHT. But anyway, so that's a summation. We got the phases of hair growth, how minoxidil supposedly, gets in there and helps out with that to increase the thickness, and numerosity is the word I'm going to create for that of hair on the scalp. We've got the side effects. Generally, everybody's different. You could have something else going on. Just always talk to your healthcare provider if you are. We got some of the contraindications, like the bad liver disease and things like that, and also talk about other options for hair loss mitigation that can be combined. Hopefully this helped people out. If you're planning on getting started on minoxidil, talk to your healthcare provider and just be aware that, not everything's rosy. It doesn't work for everybody, and that there are certain things to be aware of going into it, such as the facial hair thing, which may not be such a bad thing for transmasculine people on testosterone, but our trans femme folks out there probably not going to be fans. Anyway, okay, see y'all later. Bye.